was going to say, there it goes.
You're on.
We're on now. All right, Chairman Letman.
Present.
Sam Elters.
Present.
Verlin Tennell. Present. Susie Perel Duranso.
Present.
Joy Bancroft. Bancroft.
Yes, present.
Thank you. And Ting Wei. And do we have Rick Hernandez or Jim Hammersley available via Teams?
Okay, hearing they're not present, we do have enough for a quorum.
Okay.
We'll go ahead and proceed. Item number 3, the discussion, consideration, and possible action regarding the approval of the November 5th, 2025 meeting minutes. Did everybody have a chance to review the minutes? And if so, are there any questions? Hearing none, I'll entertain a motion for approval.
So move. Second.
Okay, we have a motion and a second to approve the November 5th, 2025 meeting minutes. All in favor, say aye.
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 All opposed? The ayes have it. The meeting minutes are approved. Let's get into our big item for the day. I believe it. Sorry, I'm trying to get my Teams up. I can't hear you. Oh, I'm trying to get the Teams to come back up to let everybody back in. I apologize. Just 1 moment. Sure, take your time. Okay, so we're going to have a momentary delay while we get Teams back up. Are we all set to go? And who is joining us by Teams?
Hello, this is John Hatz with Gallagher Benefits.
Perfect. Anybody else on Teams? Okay.
Rick Hernandez.
Let's go ahead and move to item number 4, which is a discussion, consideration, and possible action regarding offering opt-out incentive program effective July 1st of 2026. I'm glad to see progress being made on this. This is very good. Director Demers, will you be handling this, Mr. Katz, or will our CFO be handling this item?
And certainly get us kicked off on this, and then Juliana and Luke can chime in.
Okay, Mr. Katz, go ahead and take it away.
Great. So, Mr. Chair, trustees, we've been researching many possible cost saving strategies, and one is to look into offering opt-out incentives for employees. Basically, what that means is there will be a cash offer paid out to the employee if they waive coverage on the condition that they have qualified coverage elsewhere. So there are 2 types of opt-out incentives. One's unconditional, where you can just offer an incentive for folks to waive, regardless if they have coverage, but that creates a host of issues with regards to affordability and how that's calced. So the second piece is a conditional opt-out incentive, and this is the one that we're researching and considering. And that is you can waive coverage, receive an opt-out incentive, a dollar amount to be calculated, later, but they would receive that cash incentive on the condition that they have credible coverage elsewhere and provide, an attestation or an affidavit stating so. We've researched a couple other public entities that offer opt-out incentives are Pinell County, City of Tucson, and City of Tempe. You can see the ranges that they offer on the cash basis. Both Pinell and Tucson offer about $960 a year, and City of Tempe is at that $100 a month, so they're kind of right in that range. When determining the appropriate amount of the incentives, we want to look at what your current employee and employer contributions are. Kind of a simple rule of thumb is that the incentive does not exceed the amount of the employer's contribution minus the employee's contribution. That is kind of an actuarial or underwriting determination, kind of a rule of thumb. Those are pretty wide guardrails. We would be looking at firming up some numbers based on the upcoming budget. But as of now, if we were looking at the EPO plan to kind of gauge what those opt-out incentives would be, it'd be somewhere between $732.35, which is the employer contribution, and $103.64 is the employee contribution. It'd probably be much closer to the employee contribution on an annual basis than the employer to maximize the potential savings that this could bring. We'll model out there's some various incentives to look at, and we've already started that process and kind of narrow that down as we get closer to the renewal meeting once we know what we think the estimated budget is going to be. There's some supplemental information provided with a draft policy and criteria for the program, and then also the opt-out medical coverage of attestation form.
Mr. Hatz, how did you calculate the $732.35?
That's what's currently in place for the rates and contributions for this current plan year on the single coverage EPO plan.
Okay, so it's based on a percentage of what the county would put in. So we're allowing the employee to share in some of the savings that the county realizes. Okay, and how did we calculate the $103.64 for the employee portion?
That's the employee contribution. So once we set the budget, last year at the renewal meeting, we create the 4-tier rates and then there's a certain percentage that the county pays, and then a certain percentage of that the employee pays. And so if we're going up a certain amount from the prior year, both of those contributions, the employer and the employee go up, but those contributions have already been set, or that relationship has been set. So currently the employee pays $103.64 per month if they're in the single coverage EPO plan.
Okay, so the total benefit to the employee is around $850, give or take.
Correct. The total cost of yes, that is correct. Yep.
Okay, I like what I see for sure. Could you talk to us also about what the employee has to attest to? I was a little confused on what qualified as an appropriate plan. So obviously what we're saying here is you just can't opt out of our plan and go to zero insurance. You have to have evidence of some kind of alternative coverage. Could you explain that for the board a little better?
Yeah, so in order to receive this credit, you're exactly right. You just can't, that would be the unconditional opt-out, is if you could just waive coverage and then you get the cash incentive. That is something that we're not exploring. So in order to receive this, it would be the conditional opt-out, and that you have to have credible prove that you have credible coverage elsewhere. That basically means that you're going to be covered as a dependent on your spouse's plan. So if you have an individual plan or something of that sort, that does not count. So you have to have credible coverage. So you're filling out basically the affidavit saying that you can be covered as a dependent on your spouse's plan.
Okay, could you explain why an individual plan is disqualified? Why should that be disqualified?
That's a great question, and I would have to research that a little further. Why the IRS would determine that that's not proof of credible coverage if they're not purchasing an individual plan. I'd have to dive a little bit deeper on that for you.
If you could, please, we'd appreciate it.
Yep.
Very much so. The attestation requirement, so basically we're going to go on the honesty. Are we going on an honesty system, or are we actually asking the employee who wishes to opt out to bring in an actual evidence of coverage?
I'm just reviewing the draft form that we've put together. So we're declining.
Okay. Juliana?
Yeah, I mean, there is a section in the form where you check that if you are enrolled in a minimal sense of coverage through either your spouse's plan, your parents' employer plan, military, VA, or tribal services plan. Beyond that, I'll rely on Juliana if there's going to be any other required documentation to be attached to this attestation form.
Juliana?
Yes, Mr. Chairman, members of the board, yes. We will be requiring proof. It's just not an attestation form. It is, like a form completed with backup demonstrating that they do have proper coverage as outlined on the policy. And it will be renewed on a yearly basis during open enrollment, the same way that people, like any staff member would renew their benefit package during open enrollment. They would have to provide, documentation for the upcoming year that they do have proper coverage. And there are, other requirements there as well, as far as if they decided that there is a qualified event that they needed to withdraw from this program or just acquire the program within the plan year. Due to a qualified event, we would be able to process the same way as a regular benefit package.
Okay, and on item 8, which was the revocation of the benefit, there was several bullet points. The last one is experiencing a qualifying event that changes eligibility. What would that be? Like going to part-time status or something, or?
Mr. Chairman, it is the exactly same qualified events which employees would contact us to join or drop coverage. And it could be such as, like a, let's say a divorce or a marriage where they acquire coverage through their spouse, or could be through a divorce where they lose their spouse coverage and now they needed to drop from this benefit and opt in into the health benefit again. So the same qualified events as a regular enrollment health benefits.
Okay. And Mr. Hatz, under proposed criteria, I noticed that Medicare wasn't listed. It certainly is a pretty big group plan, as I recall. What, 120 million? Any reason
Yes.
why Medicare wouldn't be on this list of acceptable insurance coverage? Mr. Hatz?
Again, I'd have to research that, but I don't know that if you're Medicare eligible and you're still an active employee, a lot of times you defer your Medicare because you're still on your employer's plan. And then if you do, your employer's coverage will become secondary. So I'll have to research again further why the IRS may or may not determine that Medicare coverage does not qualify as acceptable coverage to fulfill this requirement.
Okay, perfect. Director Demers, I'm assuming that employees who wish to take advantage of this would have to do this every year.
Mr. Mr. Chairman, that's correct. So as during open enrollment, the employee would have the option to opt out or to enroll in health benefits.
Perfect. Other members of the board have questions about item number 4. Joy?
Thank you, Mr. Chair. So currently, do you have a feel for a number of people who currently have waived insurance?
Yes, we do have an average today of, it's about 106 employees that have waived benefits, but a couple, there's about like a dozen and a half that are enrolled in other employees' benefit plans. And the other ones, we don't know the reason why they waived. So we don't know if from the, let's say, 150 probably that we would have today that would qualify potentially for this. We don't know which ones would really qualify because we don't know the reason why they opt out at this point.
Okay, thank
Okay,
you.
but we don't, I'm sorry, did you?
Oh, I'm good.
No
I just
follow-up.
said thank you. I'm good.
We obviously don't know what the potential audience is for opt-out because we don't know how many people are could qualify for a spousal plan or one of the qualifying plans, correct?
That's correct, Mr. Chairman. We don't know at this point if from the ones that opt out. So I just want to clarify, everybody can opt out from, like health coverage. If you're not opt-in receiving, like an incentive in lieu of opting out of benefit, you don't have to explain or justify, you just opt out and you don't receive the incentive. So from this 150 universe we have today, we don't know how many would follow under those criteria that they could possibly qualify to receive an incentive.
Interesting. Good question. Other questions from board members? Berlin?
Thank you, Mr. Chair. Just a quick question about the entities that Mr. Hatz has included, Pinal and Tucson and Tempe. Is the $960 a year, is that the total cost that the employee would be paying for those areas?
No, not necessarily. So for example, it's a range. So let's just say City of Tucson, because I just happen to have their contributions up in front of me. They offer 3 different plans, and the employee contribution varies by plan. So for example, if they're in the lowest cost plan, they pay about $13.50 a month. All the way to the most expensive plan, they pay about $58.57 a month, and that's if you're in the lowest salary tier. So there's a lot going on. They have 3 plans to choose from, and then they also have contributions that are based on salary tier, and they have 3 salary tiers that the more higher comp you are, the higher percentage of the premium you pay. So the $960 per year would be beneficial to folks in the 2 lowest salary tiers, and then in the 2 lowest plans. And then if you get into your higher comp and then you're into the highest cost plan, it's less than the annual amount that they would pay. So there is a range.
And are these the only 3 that statewide participate, or those are just 3 that you picked?
Those are 3 that we have found with looking into available kind of public information that we're able to access and see, who's offering opt-out incentives, and then also have the ability to look at the plans they offer and the contribution structure that they have in place. There certainly could be more, but we have not run across those up until now. These are the ones that we were able to find for this meeting.
Thank you.
Good question. Susie?
Yes, thank you, Mr. Chairman. This is only for the medical plan, right? It does not include the dental plan and the other plans that we have.
Question.
That's correct. Yes, this would be based on opting out of medical for the opt-out credit. We have not looked into modeling, a minor opt-out incentive for other coverages.
Thank you.
Manager Elters, did you have a question?
I did, thank you, Chairman. John, good morning. I'm assuming the three entities that you're comparing us to also have conditional opt-out? So we're comparing apples to apples?
That is correct. That they are conditional. And again, not to get too deep into the weeds on what the unconditional does, but if you do an unconditional opt-out, it doesn't count. It counts against the affordability calculation. So the amount that the employee pays or would pay for electing coverage, the opt-out incentive would be added to that. So it creates a mess when determining affordability, essentially. So that's why the unconditional path is the one to go down.
Mr. Chairman, if I may continue. John, thank you. I'm not advocating for an unconditional approach. I was just making sure I understood the comparison. One other question, and it's literally a follow-up to a question that the chairman asked. Under the disallowed coverage, individual marketplace exchange plan, I think it would be helpful, at least to me, to understand the definition of that. What does that mean? Is that an individual, just a person that is not a dependent and not married and not associated with anyone else that may choose the marketplace exchange? And if that is the case, why would that be disallowed? The other would be individual private medical policies. I guess understanding the individual plan definition would be helpful, and I know the chairman already asked that question. The third and last question that I have for the two of the three entities being Pinell and City of Tucson, I guess I would be interested in knowing what the average overall, not just what the employee cost is for those plans, but what the entity being Pinell or the City of Tucson subsidy amount is. So understanding what the total cost, the total annual cost of the plan, and comparing that to those numbers would be helpful as well. Thank you, Mr. Chairman.
Okay.
Thank you. Berlin, did you have a follow-up question?
I don't have a follow-up. Not a follow-up, but a new question. John, do you have any stats that would show the savings to the county in any of the policies that you've written?
Good question.
Unfortunately, I do not have any data that suggests what the potential savings could be for including a program like this. It certainly could vary based on the amount that you choose to offer as an opt-out incentive, the amount of folks that are currently waiving, and then the amount of folks that waive in addition to the current amount. So there are a lot of factors to determine, what the overall savings could be. And then also the piece that is even more unpredictable is not just the amount that you're saving from the contributions or getting folks off your plan, but the largest component is the claims that they would be or would not be incurring while on your plan. And so, long story, I don't have any data at my fingertips or any actuarial data to suggest that there is a rule of thumb or a certain percentage of savings when implementing a program like this.
Okay.
Mr. Chairman, how long has Tempe or Tucson or the areas that you've identified been on this program? Is it a new program
That's
for
a great
them,
question.
or-
looking back, I couldn't find any data or anything that gave when they implemented it. Just looking at the dollar amounts, and then this type of incentive being offered, I think they've been in place for quite a while. And that's just speaking anecdotally based on the numbers that I'm seeing. The 960 and 1,000, and then looking at their overall plans, it looks like they've been in place for quite some time.
Thank you. John, what's our next steps in this whole process?
Next steps, since we're supplying you with the kind of the information and the research on this program, the next steps would be when we get together for the renewal meeting. We're determining budget and what the new rates and contributions would be. We would have a set number that I myself would work with staff on developing a recommendation on what the opt-out incentive would be if you choose to go down that path, and then that we would be able to put that to a vote to implement that effective 7/1.
Thank you. Manager Elters, there's a side of me that says we should give an update on this to the full board, just to take the temperature in the room, okay, of my four colleagues. Are appropriate or not?
Mr. Chairman, absolutely always appropriate, and transparency is very relevant and key in these situations. So I would sincerely recommend that. The timing of it, I think, could take place early next year, and maybe it would be timed just before. It would be timed once we have answers to some of these questions that we're asking here, and in working with Mr. Hatz and staff to get to a range or a ballpark where we can put something in front of the board as a whole that we can recommend, stand behind, explain, and justify any related benefits or advantages to it, and take their temperature. But absolutely, I think something like this would be.
So I'd recommend maybe a meeting in February. That should give us plenty of time to get some more concrete numbers. Again, I just want to take the temperature in the room of the other four supervisors to just be sure we're not heading down a path that some of them don't think is appropriate. I think this is a potentially significant, alteration to the plan. I mean, I personally like the idea, and I think I'm for it, but I'm not going to speak for the other four. So,
yeah, I think it would enable us to refine the plan and the benefit from it. The savings, I think we can put them in two buckets. If indeed the cost of the plan per employee is X, and as a result of this conditional opt-out option, we reduce it to some number, the employee is getting the benefit of being paid for opting out, and that number we can, we can have confidence in. I don't know, to John's comment, I really understand. I don't know how you would quantify what type of a claim an employee who is opting out may have otherwise, and so on. But I think at least it positions us to explain to the board at least the known benefits and quantify those numbers, and then see how they feel about it.
okay, so Juliana, let's presentation, maybe the second meeting in February. That should give us plenty of time. Do you want me to put it on under me, or do you just want to do a presentation underneath HR?
Mr. Chairman, I can do a presentation under HR if you prefer.
So you want to put it on?
I can do it.
Yeah, okay. Second meeting in February?
Is that before the annual meeting that we're going to have?
Yeah.
Yes.
Okay. And that way we'll have some.
Yeah, we have some temperature in the room. See how they feel about it. Luke?
Chairman, I just have a few comments. Just listening to the conversation and going back to to kind of touch again on some of the questions that came up. As far as those qualifying events where an employee can either decide that now they want to opt in for the incentive or now they need coverage again, finance's preference would be that we do this incentive with each regular payroll cycle. The reason being, if we were to do it once a month, and an employee has a triggering event in the middle of the month and they've already received the incentive, then we are in a position where we have to then go back and try and recoup a part of that from the employee. It's far simpler to just do it each pay cycle. That way we don't get into situations where we have to, be hassling employees or dealing with the administrative burden of trying to track them down and say, we need you to refund a piece of this to the county.
That seems like a reasonable suggestion. Okay.
Another question that was posed to Mr. Hatz was about Medicare. I would just say, in reading some of the IRS literature, it appears that what you don't want to be doing is attempting to specifically incentivize employees from dropping the employer plan in favor of some other taxpayer-funded type of health care, i.e. Medicare. It is interesting that VA healthcare is allowed, but you're not supposed to specifically target Medicare. But I just wanted to offer that. I know John's going to look into it a bit further, but that appears to be the general gist of why certain types of healthcare programs are not qualifying for this. The other thing I wanted to point out, just to make sure that the entire board is aware that this cash incentive to employees, if they do opt for it, it is taxable fringe benefit to the employees. And so when we are trying to come up with a recommendation for an incentive amount, what we will be doing is looking at what does the employee currently pay in healthcare premiums, and realizing that there's three buckets, right? There's what the employee pays, and then on the county side, it's split into two buckets. There's what their department, from a budget standpoint, pays, and then there's what the trust pays in. The trust piece is a lot smaller than what the department pays. But we will look at what the employee pays, and then we will do what's called a grossing up for the tax impact, because right now they pay their premiums pre-tax. The fringe benefit that they will receive as additional compensation will be taxable to them. And so what we'll do is we'll just use an average tax rate of, say, 20%, and say if they're paying $50, we gross that up for the 20%, so that the net effect to the employee is that they're receiving an amount that is equal to the additional tax burden that they would receive as well. And then we can kind of back into what are the savings to the county from a department standpoint, which from my perspective, for all the general funded departments, that's a great deal for the general fund, because they're going to save quite a bit of money for each employee that opts in, and then also for EBT as well. And I think that was all the commentary I had. Thank you.
Get it ready for second meeting in February. Pretty good. One last question. Are there any groups of employees in the county that don't partake of these particular health care plans? Everybody's on it, right? Sheriff, courts, jailers, everybody.
That's correct, Ms.
Okay,
Everybody.
thanks. Okay.
Mr. Chairman,
Susie?
just a question to the Finance Department regarding taxation. Normally, premiums, you can take that as part of your taxes when you file your income tax for medical expense. So this one is not anymore a medical expense once the county starts subsidizing or giving back some incentive, correct? I mean, this question probably is more for the employee. You know, how am I gonna manage now my premiums in terms of my taxation? Some are pre-tax, some are, you are able to get it at the end of the year when you file your income tax as premiums. Since these are not considered medical premiums anymore, and you get money instead of being deducted, you get taxed for it. I think the employee needs to know that, correct?
I agree, and my advice would be that what is communicated to the employees is they need to consult their tax professional, because that's going to be a different situation for every single employee, depending on the very specific facts and circumstances of their tax filing status and their overall tax scenario.
Yeah, I understand that, but we need to they need to understand that as far as we're concerned, we're going to tax them in terms of the benefit, or in terms of the whatever money they're going to receive out of the payout. Or
Yeah, yes, and that's why I made a point of making sure the board is aware it is a taxable fringe benefit. It will be additional wages to the employee, and we will make sure to communicate that.
Okay, thank you.
But your intent is to try and gross up the tax hit.
That is also correct.
Right.
So when we mock up values for what we recommend that incentive amount be, you can see the three entities that John put in the backup for comparison. Ours is likely going to be a bit higher than that because in part it's based on what is the employee paying into it. And the lowest amount that an employee on the county's healthcare plan pays is $51 and change. That's for a single employee for coverage just for themselves on the EPO plan. I think John said that the lowest tier of coverage for employee premiums for, I think it was Pinnell, was $13. So you can see there's quite a bit of difference there, likely because we're self-insured and our premiums tend to be a bit higher. So that will be taken into consideration. I did want to add one other thing. When we're looking at this, I think for me, the big unknown is the fact that we have this bucket of employees that currently don't participate in the health coverage. Juliana said there's about a dozen of them that we know they don't participate because they're covered by a spouse who's also on the county plan. The real question from that bucket of employees that are not covered, if they have other coverage and they decide they want the incentive, they'll provide proof of coverage. But in order for this to actually realize any savings for the county, we're going to need to have more employees that are currently enrolled drop than employees who are not currently enrolled who opt in. And we can't what's the word that I'm looking for?
Double dip.
Well, we can't say, hey, you already don't have coverage. You're not qualified to be part of this incentive plan. So just to be aware of that. That's kind of a big unknown.
Your point is well taken, but again, all I need is one covered, currently using our plan. If we're giving back roughly 10% of the savings to the county, I only need one employee to cover 9 people who aren't in the plan today, but want to take advantage of the opt-out because they're on somebody else's plan. I like those numbers. Those sound good to me.
Mr. Chairman, just a couple of other things. I don't know that we're necessarily going to have the savings that we hope to, because probably a lot of our county employees are married to other county employees, so that's not going to affect a lot of those, I would assume. Also, one more question for John is, how will, if we lose 10% of our employees to this program, or not lose them, but 10% decide to enroll in this, how will that affect us when we go out to bid, minus 10% of our employees? How will that affect our bids for people, based on our current numbers of employees?
That's a good question, and that really should not impact any of the RFPs as it relates to the medical coverage, because you are self-insured. So knowing that you are the insurance company, if you lose 10%, you're not going to lose that much leverage in purchasing administrative costs to manage the self-funded plan. So I think that is probably the most minimal risk is on the RFP side. I think you'll still maintain from your size the purchasing leverage. Now, if you lost 50% or something like that, that might be a different story. But 10 to 15%, I don't think is going to impact your purchasing leverage through the RFP process.
Mr. Chairman.
Please.
I think since we're talking philosophical about what might happen and what the savings will be, I think we really, we will proceed cautiously. And between now and when we brief the Board of Supervisors, I think we need to have some better handle on these numbers. I was unaware that we have somewhere around 160 to 165 employees today that are not part of our healthcare plan.
I'm one.
So we should understand the makeup of that number a little bit better before we make too many decisions. It's one thing to have employees who are part of the plan today with an associated cost, who have options to opt out that would qualify under this draft and that would opt out versus those that are not on the plan today and would opt out and be collecting. That could truly offset and maybe even deplete any vision of savings that we may have. So I think it's really important that we proceed cautiously and understand to the extent possible where those employees are and what the numbers are before we, again, we just agreed that in February, we would be briefing the Board of Supervisors to take their temperatures, but I think part of that temperature taking should include, detailed best information available to be shared at that time.
Yeah, Susie, go ahead.
Mr. Chairman, thank you. Talking about cost savings, I'm going to ask, this is going to be additional work for HR and finance as well. Would the additional work be worth the savings we're going to gain for both departments?
Mr. Chairman, members of the board, it's the administrative work for this is not really different than the one that we currently do to enroll everybody during open enrollment.
Okay.
And it's basically just collecting the form and collecting the proof of insurance.
From a payroll perspective, it's pretty simple for finance because HR will simply pass us a list each pay cycle that says these are employees that continue to qualify for the incentive. We add it as a pay code on that employee's profile, or more likely than not, we just continue to have that pay code on their profile, and so we know that they're going to qualify for whatever that incentive amount is. It's simplified by the fact that we are only going to have one incentive amount. It will be uniform across anyone who, all employees that participate will receive the same amount.
Thank you.
Okay, Director Dimmers, when you said 160 is this pool of people who have opted out, I'm assuming those are eligible, so that wouldn't include like part-time employees.
Mr. Chairman, that's correct. That's just eligible employees.
I'd be willing to bet many of them, like myself, have an individual plan that's pretty damn good. Okay, and then I don't want to trade my individual plan in for a county plan, but I may be in a very small minority of that 160. My guess is a lot of those are probably going to be folks under 25 or probably on their parents' plans, and that would qualify them for the incentive to opt out.
Mr. Chairman, I can tell you, just, by a report that we pulled, that the group, the variety in ages, it's basically, it's very all-inclusive. I have employees from their, 20s to their 70s that qualify within this pool of 160 employees.
Okay. Do we have any more questions or comments on item number 4? There's no action required today other than come see us second meeting in February for the board, and we'll get ready for that meeting.
Hey, Rich.
Terrific presentation, Mr. Hatz, and by staff. Thank you all for your work on this. I'm glad to see us making progress. It's all going to come down to what the data says, okay? And I like to trust data. I think it's a good thing. Let's move on to item number 5, which is a discussion, consideration, and possible action regarding contracting with FedLogic effective July 1st, 2026. Mr. Hatz, it's yours.
Thanks, Mr. Chair, trustees. So again, kind of working on, researching avenues that can result in not just savings to the county, but this program could actually benefit the employees as well. So what FedLogic does is they're a team of experts that focus on federal and state government programs that guide employees through that complicated process of finding benefits that they may not know exist. So this isn't just working with folks to try to get folks off your plan or anything like that. This is essentially an extension of your staff to help employees that qualify for all these other state and federal programs that they may not know exist, don't have time to research. Premature babies is kind of a, one that comes to mind, that they may not know what benefits they're eligible for. So this really isn't a program that deters people from using the county benefits or anything like that. This is actually an enhancement to help your employees find benefits, again, that they may not know exist. And as a result of that, it's a positive byproduct. The employee may get a better benefit than they normally would if they did not pursue the path to find these programs. And then as a result, the county may save money when the employees take advantage of these programs. So it is kind of a win-win. We've attached some supplemental information that, shows their proposal for the cost, which is about $40,000 a year. Dives a little bit deeper into the benefits they provide, and then also shows a few case studies of kind of how they operate. And then in addition to this, my team, Amanda, is working with FedLogic and coming up with some presentations that they're going to present, and I believe we're going to issue a link to those presentations for you all to join at your convenience, and have a chance to listen to them themselves present what they have to offer and ask any questions. Amanda, anything to add to that?
I think that's a very good answer. Does any members of the board
Sorry, I
have
was on
questions
mute.
about item number 5? Berlin?
How does the employee know to go to FedLogic to look for these benefits?
This would be a service that the county employs FedLogic, so it would be part of the communication plan as the benefits. So anytime somebody comes to HR, if you're partnering with them, HR can defer them or get FedLogic involved. They can contact them directly, but we would rely on the communication information of FedLogic to be included in all employee communications, enrollment communications, new hire kits, things like that, and even any monthly reminders that may go out that this benefit is for them. So work with staff, but then also communicate directly to the employees that this programs are available, or these folks are available to help them.
Mr. Elters.
Thank you, Mr. Chairman. John, in looking at the backup that was provided and the reference to return on investment, so indeed, if we were to sign up for this program, it would be about $40K a year. The presentation alludes to or speaks of a return on investment because it's a benefit to the employee and may result in a true benefit to the trust. Would a future presentation by FedLogic highlight that or help this board, the Board of Trustees, understand?
Yes, that's a great question. I believe
benefit?
so. Yeah, that's a great comment and question, Sam, that I do believe a presentation from FedLogic, either the ones that we're going to become available here in the next few weeks for you, everybody to participate in or join. In addition, we can also work directly with FedLogic to maybe have them come out during our renewal conference and as part of the vendor presentation, present directly to the board. So I'll leave that at your discretion, but those would be the two avenues that we have available to us right now is the meetings that we've already set up, but then we can also explore direct vendor presentation during the renewal conference.
So, Mr. Chairman, if I may follow up. John, thank you. I would assume the meeting or the presentation that we would have access to sit in on in a couple of weeks would be more general, more broad in nature, not necessarily tailored to Mohave County. They would be talking about their benefits, and we would be able to understand how the program works. If, based on that insight and understanding, we decide, gosh, this does have value, and we do indeed contemplate moving ahead. At that point, and prior to the annual meeting where this board of trustees would be making a decision, would be really good to have them do a presentation to this board. So the data and the numbers would be specific to Mohave County, would be more relevant to make an informed decision.
Do we have any other?
Yes.
Director Demers.
Mr. Chairman, Sam, I will be starting like today. I was just waiting for this meeting, to communicate about FedLodge. I already have 3 presentation links, which I'm going to send for to ensure that like everybody can attend separately on your own time. Those are general overviews, so it is actual live meetings with FedLogic representatives there. They are going to be talking about the program as it applies to government agencies and other industries, and with an option to also ask of any questions, but not tailored to Mohave County. But at least we'll give a better understanding of, the details and saves, and they talk about case studies and, some opportunities for, like us, if we decided to, to bring them as our partner.
Thank you.
Okay. Any other questions on this item? There's no action required. Let's move on to item number 6. I was very happy to read this one. This is going to be a wellness program update. Who will be handling the presentation on this?
I will. Tori.
Tori, welcome.
Good morning, everybody. I am also excited to share this information with you today. As a reminder, before I jump into some of the data and statistics that we're looking at, as a reminder, Digby is set up to be at a minimum a 1-year program for employees to engage with. So the numbers that we're looking at today are a higher level overview of the first 5 months of the program and the initial results that employees are starting to experience. As we approach the 1-year mark, that's when we will have more detailed metrics to share regarding employee outcomes and how that's beginning to translate over into medical claims. So looking at some of the highlights of the first 5 months, we are seeing some great initial results with weight loss. There's currently 186 employees enrolled in the program, and within that 186, 126 of them have lost weight, and 52 of them have lost 5% or more of their weight. And 5% is kind of that clinical threshold where you start to see shifts into better metabolic health, better energy, reduced cravings, lower long-term metabolic risks with high blood pressure, cardiovascular disease, things along those lines. Digby is also, now that we're a few months into the program, starting to report on mental health benefits that employees are experiencing, because as we know, everything is connected in the body. So as we improve our physical health, mental health outcomes typically shift alongside that as well. So those who reported minimal to no depression increased from 20 to 31%, and those who were reporting severe depression symptoms fell from 13% to 11%. This lowers near-term behavioral health risk and strengthens overall workforce resilience. The utilization overall of the program, so how often employees are logging into the app, engaging with their coach, logging health metrics, is holding strong at 11.38%, which is more than twice industry norms, which we typically see at about 4 to 5%. So again, really only being 5 months into the program, these are really fantastic results to see. As you can see on the second page of the monthly enrollment, it is very, very normal for any new program to see immediate spikes in enrollment the first 1 to 2 months, and then for it to drop off after that. Especially we were around summertime, kids going back to school, last minute trips before the school year starts. This is no reflection on Mohave County or the implementation. I have a few other groups who implemented Digby at the same time as well, and this is pretty much what all of their enrollment statistics looks like. Really high the first 1 or 2 months, and then it drops off. So the goal obviously is to continue to increase that engagement, but I did want to call out that it's very normal when you hit like month 3 or 4 to see a decrease there. You will see an increase in October. October is when Mohave County held their health fair, and they had a Digby representative come to the health fair, talk to employees in person, and that 24 enrollment number coincides with the date of the health fair and the following few days after. So it was well worth it to have Digby come on site and talk to employees. I'm jumping a little bit ahead, but at the very bottom of my presentation, I have some ways to bolster engagement, and I just wanted to call out how this ties into how the success of bringing Digby on site for the health fair. You can only send so many emails, only send so many flyers, right? Getting in front of employees, talking to them face to face about Digby or really any other wellness program is truly the most impactful way to ensure the success of any program that's being offered. Right below the monthly enrollment, you can see some of the metrics regarding the digestive health. So this is also an area that that Digby is monitoring improvement, specifically with IBS, because there are a lot of healthcare claims that come along with IBS and IBS diagnosis. So we are excited to see some shifts of improvement there as well. And some of the marketing techniques that we're doing alongside Digby is to call out these different benefits of the program. Marketing regarding gut health, marketing regarding mental health, emails about resolving skin issues. So we're really trying to communicate to employees that this is not just a diabetic program, but it really is a whole person, whole body health program that is available to them. I've included some member feedback that I'll allow you to read through at your own time. There's some really great, just feedback from employees who are really not only enjoying the program, but seeing meaningful, just really big impacts to their health through this program. I've also, again, included some ways to bolster enrollment, just further ideas on how to continue getting in front of employees about this program, talking to them face to face about it, highlighting employee testimonials within the organization, meeting with department heads to educate them on the program and encourage their promotion of the program to employees, hosting quarterly lunch and learns. Again, employees are all coming together. You're talking about it face to face with them, and hosting further in-person wellness events like the health fair, things like on-site fitness classes, meditation classes, meal prepping classes, and using these opportunities to not only create a sense of community within the organization around health and wellness, but use it as an opportunity to talk to them and engage with them about the programs that are available to them. So as I said at the beginning, as we get closer to that, the end of year one with this program, we'll have a lot more detailed metrics to share regarding the employee outcomes and how that's starting to translate over to medical claims. But I hope you're excited to just see some of the initial results of the program and the positive impact that it's having on employees already. Happy to answer any questions about it as well.
That was an outstanding update. Manager Elters?
Thank you, Mr. Chairman. Tori, my question pertains to the chart for the month-wise enrollment and understanding that. So we have 186 employees participating, clearly started strong, and then it tapered off for the reasons I think you described. My question is, are all 186 employees engaged at a similar level, meaning there is a benchmark or a threshold that of engagement that is being monitored, so that you can say yes, they are continuing with it, and if not, what does that mix look like? And as we strive to raise the number from 186 to something higher, what can we do to ensure that those that signed up continue to be engaged with it?
Yeah, that's a great question. So utilization and an overall engagement of the population, I believe, is around 90% right now, which is a really fantastic number to see. I believe that the engagement stays high because employees are not only interacting with a real health coach at their fingertips through an app, it's like messaging with, a personalized dietitian, but everything that they're doing is specific to them, and also, responsibility for their outcome also falls on their shoulders, right? Part of the app and the program is taking pictures of your food and getting feedback from your coach on it. So, if you're not taking pictures of your food, your coach doesn't really have a lot to work with. So I think, this kind of shift to making the employee feel some responsibility for their health and then starting to see these positive outcomes is how you keep employees engaged. There's just a sense of like ownership about it and more self-awareness around their choices. And just in conversations with employees about it that I've had over the last 5 or 6 months, this is a lot of what I'm hearing is, I want to engage. I want to keep it up with my coach because I'm feeling the direct positive impacts of it. So I think that's what makes the engagement piece stand out a little bit with this program compared to other programs. And I think, Digby provides a lot of resources for employees that also encourage their continued engagement. They not only have the opportunity to interact directly with their health coach, but there's group health coaching sessions. And I also want to add too, that this program as a whole is really set up to the bulk of the work happening within the first year. As employees transition into the second year, they actually phase into kind of a lighter version of the program. And the program is designed for employees to come off of. So I think, kind of the unique approach with their personalized health coach, their group health coaching sessions, the continued education, and this sense of ownership that they have compared to other programs is a unique way that helps them stay engaged for the long run. I feel like that was a lot. Did I answer your question?
Yes, you did. Thank you so much. Thank you, Mr. Chairman.
Thank you.
Do we have other questions? Director Demers, any chance you'd like to come tell the board about this success story in late January?
Mr. Chairman, yes, absolutely. We will put a report together to, just to reinforce the questions that Sam just asked, Tori. I had a meeting with John to prepare for this meeting like last week, and I will be producing, a report where we show sign up enrollment versus, engagement and then results. And just explain what are the next steps that we're taking to improve, enrollment. You will see on the graphic that was provided to you on the package that the enrollment kind of somewhat spiked again in October, and that was because Digby was here for the health fair. So we know that when there is, in person, or when there is a higher effort in trying to bring the information here and show the results and having this interaction, we see that people will try to engage again. So we have a higher engagement in October due to the health fair. So we were thinking about creating other opportunities to see if we can bump up this enrollment number, but also compare to utilization.
I'm assuming at the end of January, you'd have data for the first 6 months by that point in time.
Yes, that will be, yes, correct.
Okay, I firmly believe we need to share more good news with our Board of Supervisors, and this is definitely good news. Has good long-term impact. Any other questions about this item? Okay, no actions required on this other than get ready for yet another presentation of the board. Let's go ahead and move to item number 7, which I think was the administrative update. And the only item on that, let me get my notes out, was that we'll go ahead and schedule the annual renewal meeting. The 2026-27 annual benefits renewal meeting is scheduled for Friday, February 20th, 2026 in these chambers. Any questions on administrative update? Okay, let's move to item number 8 in the agenda, which is requests for future action. Do any board members have requests for future action? No, I have one. So at our annual meeting, we talked about some providers in the area who seem to be providing services to the trust members, the employees, at excessively high costs, okay? One of them was the Exceptional Healthcare Hospital in Bullhead City. I would like staff to pull a report and tell us how are we doing with exceptional healthcare. As I recall, when we looked at that particular provider, the number was well in excess of what other providers in the area were charging the county. And obviously, as we look at this, getting ready for that meeting in February, the question on my mind is, do we have control over pulling providers out of our program, okay, where a reasonable alternative exists, and that hospital is midway in between Valley View and Fort Mohave and Western Arizona Regional Medical Center up in Bullhead City, and I am still perplexed why we have employees going to this high-cost provider, if in fact they still are a high-cost provider. I would like to know that, and I would prefer not to wait until February 20th to find out. If you can get us some numbers, please, and anybody else that falls into that range, because I recall that particular provider was simply the highest on our report, and I question why that is. So if you can get us data before that, otherwise, let's put it on that February 20th meeting and make a decision. Do we have the right to ask our employees not to go to a high-cost provider when there's a reasonable alternative a mere miles away from that facility? And I would assume that facility is not the only one that we're looking at. So that's my request for a future item. Any other items for the good of the board?
Mr. Chairman, This has been in my mind for a while, and I'm not sure whether our board, the EBT-SIR board, has jurisdiction over it. And I've discussed that with HR some time ago, many years. We have other benefits that we provide the county, like the retirement, the nationwide, and whatever. But it seems like there's no avenue for them to come and present the results of those programs to the county, other than probably the open enrollment. Is there any way, although there is no money involved in the trust that's being used for this, is there any way that this retirement programs that we have, the nationwide and whatever, whatever programs we have right now, at least present the information to the board for how they're doing with the retirement programs?
Are you talking about alternatives to our ASRS program, Arizona State Retirement System?
No. The ASRS is one. We
that's
have other
mandated.
types. We have nationwide, and I don't know what else we have.
Well, you're talking about other types of insurance programs.
No, not insurance, retirement programs.
Retirement.
Other types of retirement programs that open to employees to participate. Now, these are voluntary because the SRS is required, the voluntary. When I spoke to the staff in those, there was no avenue for them to present how they are doing as a retirement program offered to Mohave County employees because we don't give them any money. It's a voluntary thing, but they would like to present how they're doing, in the other optional retirements that's provided to the county. Is there any way our board can at least get their reports? I mean, we don't have to make a decision for them until their contract ends probably and say, okay, are there any other providers for retirement that we can contract with as part of the county?
Manager Elters.
Mr. Chairman, thank you. If I understand it correctly, we have two providers for additional retirement options. These are voluntary, unlike the ASRS, which is mandatory. If you're a full-time employee, you're automatically into ASRS, and the relationship is different than the other. I think of like the deferred compensation of 457.
Yes.
I think that's a unique, and I think I understand what Susie's talking about, but this is a relationship, because it's optional, it's voluntary, it's a relationship between the employee that chooses it and the provider that they choose to provide that service to them. For example, I am with Nationwide. I signed up with them when I returned, and I have an account. I check it regularly. I get statements. I know how it's doing, and all that stuff. But that is specific between me and Nationwide, the county, other than I am an employee of the county, so the platform is provided to me. There's really no, so I don't know if you're asking, for example, Nationwide to come to this board and explain how the accounts are doing, or what?
Yeah, Mr. Chairman, may I? Although it's voluntary and it seems like it's a relationship within the employee and that, actually the contract is with Mohave County. Mohave County has a contract with Nationwide. And in fact, there was a time when they were saying, well, how long does this contract end? It seems like there was nobody is following this thing, and yet it's being offered to our employees. It's a contract with Mohave County. Nationwide has a contract with Mohave County. It could have been in one time there was another provider, ICMA, which was another contract provider. That has since gone away. But what I'm saying here is that it's a contract between Mohave County and Nationwide. Without that contract, Nationwide cannot offer that program to Mohave County employees. All I'm saying is that I know it's voluntary, but there has to be a platform wherein these providers can at least give us how are their retirement programs doing. There was a time when there was a letter that was given, there was a change, but nobody knows about it because nobody is presenting it to the county, and that was a change in the retirement program, and employees didn't know anything about it. So
We visited that before, Mr. Chairman and Susie. I think HR does get some enrollment numbers. I'm not going to speak for Juliana. I'll ask her to address this. But you know, my point is, the employee decides whether they're going to enroll or not. The employee decide how much they're going to put in. The employee decide. All this is a platform. I don't know, for lack of better terms, it's not an extension of ASRS, but it's sort of related to it. You have to qualify to be in this program to even opt in. So I don't know what reports, if we get like numbers related to, you have.
Yes.
Say that again.
Juliana.
Do we get updates monthly or otherwise from nationwide related to the deferred comp as to how many employees and so on?
Mr. Chairman, Sam, members of the board, we can also pull this report from our payroll deductions, because a lot of those savings, when the employee chooses a supplemental savings plan, which that would be, like an investment plan from Nationwide, a supplemental savings. It's not a retirement account, it's a supplemental savings account. So if they choose this through Nationwide, which is an offer from ASRS, we could, because those contributions to those plans are done through payroll, so we take the deduction from the employee and invest, like on their plan, we could pull this information. So we can tell you how many employees are enrolled. Now, as far as the return on investment or the type of plans or the allocation of the investment choices of each one of the employees, we don't have that data. What we can provide is the number of employees that are currently taking advantage of a supplemental savings plans offered by Nationwide through ASRS.
Oh, Chairman, before going further, I just want to make sure we identify that is the Nationwide a part of benefits for the trust to administrate it, or is just for the HR? Because that would not be
It's
out of scope.
Yes, so members of the board, it's through ASRS. So the supplemental savings plan through Nationwide is, the Nationwide supplemental savings plan is a voluntary benefit provided through ASRS, not the county, not directly with the county, it's through ASRS.
Okay, so what you're suggesting, a little outside of the purview of the trust. Susie?
So
Okay,
if
just, oh, I'm sorry.
So if this is outside of scope of trust, it should be not be in the part of the meeting.
I just follow up to what I said. I think in talking to the Nationwide staff before, they provide a quarterly or biannual report to HR on how the retirement plan is doing. Not individual accounts, but how the retirement plan is being managed, and, do you still get those reports?
Mr. Chairman, board members, I'm going to have to look into more details into this, because this is not considered, what we have today is not considered a retirement plan, and is not a contract with Mohave County. Again, it's a supplemental savings plan provided through ASRS. It could have been that at a certain point in time, which I don't have this information today, but more than happy to look into, could have been that the county had a direct contract for a supplemental benefit with Nationwide, the same way that they did with ICMA. So I needed to look into this, and I'll get back some information to see if this something that is any preview that the county has a contract or had in the past.
I think, Mr. Chairman, we do have a contract. In fact, there was a contract between Mohave County and Nationwide for the implementation or the 457B plan.
Okay, take a look at it and get back to us.
It will do.
Mr. Chairman,
Sure. We're down.
question, if the retirement plans are a benefit to the county, why are they not appropriate for this board, first of all? And second of all, if Nationwide is a retirement plan, are there other platforms available?
Why don't we tackle that first question, either Juliana or Tingwei?
I'm checking the statutes right now.
Mr. Chairman. Sure. I think it may require some research for our staff to do that. Maybe it could be a future action, just to come back to us and say, like the question of Verlin, if it's a benefit to the county, if that retirement program, and it's a contract between Mohave County and Nationwide, where's the avenue for us to get how they're performing, or how we can cancel the contract because they're not performing and look for another platform.
Okay, Ting Wei, do you want to defer this to February?
So, I just for the question before, so under the ARS-11-A981, the county's trust is established under this statute, and this statute was for the county to establish a self-insurance program for the management and administration of a system for direct payment of benefits, losses or claims, or any combination of insurance and direct payments, including risk management conclusion. And I don't think the nationwide supplemental retirement plan should be the discussion in this trust.
Okay, we'll let you research that further, and we'll address this in February. Sure.
Chairman, I just want to clarify. So ASRS is mandated by statute. That is a retirement plan. The nationwide plans are supplemental savings plans. They are not retirement plans. We should not confuse any language there. They are not retirement plans, period.
Okay. Okay, barring that, any other comments, questions from members of the board? Hearing none, before we adjourn, Manager Elters, this is potentially your last meeting. No. Yes. Potentially.
Potentially.
Yeah. We'll find out starting later this week, tomorrow and Thursday, how we're going to go down that route. But thank you very much for your service to the Employee Benefit Trust. Anything you'd like to tell us in 20 seconds or less?
Just that it's truly been a pleasure serving on this Board of Trustees. It's meant the world to me to be able to provide insight and perhaps provide a little bit of guidance as to what decisions we made and how those serve our employees. It'll always remain with me. I was part of it before, but to serve here is truly a privilege that I don't take lightly at all. Thanks for the opportunity, and it's a pleasure serving and working with all of you. And we don't have a definite date, so you may see me in February, but hopefully not. And we'll see how it goes.
We'll see how that goes. Mr. Katz and Tori and all of staff, thank you very much for your presentations today. Well prepared, well done. Merry Christmas to everybody who's involved. Okay, and Happy New Year. We'll see everybody on February 20th. The meeting's adjourned.
Thank you.
Thank you.
Thank you. Merry Christmas.
Thank you, Merry Christmas.